Hello, everybody. Good morning or afternoon, depending where you are located. Thank you so much for joining us for our first interview in our new series, Equity in Action, Conversations with CareerSTAT Champions. I'm Melissa Kleder, Program Manager on the Employer Activation Team here at the National Fund. I'm going to do some quick level setting, but aim to get to the protein of this conversation as quickly as possible because that's where the good stuff lies. So if you're unfamiliar or new to CareerSTAT, CareerSTAT is our national healthcare sector strategy and is a key part of our work to activate employers to make jobs better. And the peer-led Frontline Healthcare Worker Champion Recognition Program relaunched last year after a few years of hiatus, and we are thrilled to recognize 8 organizations for their work to create good jobs, to build equitable workplaces, and to make significant investment in the skills and careers of their frontline workers. So one thing to know about me is that I will almost always have a question. Anytime that you get to that portion of an event, I'm almost always there with a question. And as I read the applications for our champions, that was absolutely true. I immediately was like, I want to know more about this and I want to dig into this. And instead of me having one-off conversations with these leaders and these folks doing really good work on my own and reporting it back out to the network, we are inviting you into this conversation with the Equity in Action series. You will get a taste of what the programs and the practices that these organizations have in place. If you are a CareerSTAT member, there will be future opportunities to take a little bit of a deeper dive, and I will share a little bit more of that at the end of this interview. But for the time being, while we will have opportunities to answer some questions here, I suspect we won't get to all of them. So I encourage you to open up your little virtual sticky note or your OneNote app or whatever it is you use to keep yourself organized, to just jot down some questions that you have. And that way that we can get them and we can work on answering them if we are not able to get to them in this interview. But with that, let's get started. And I am delighted to have Jerry Baake, Director of Workforce Development at the University of Vermont Health Network, as our inaugural guest. Welcome and congratulations to you and your team, Jerry.
Thank you. It's an honor to be here and an honor to be accepting this award on behalf of the organization. So I'm so excited to be able to talk to you here.
Fantastic. So y'all had some really interesting nuggets in your application that I'm eager to learn more about. But first, I want to take a step back and get started on the personal side. In workforce development, we're often talking about career pathways and navigation, and not always doing the reflection of how we got into workforce development ourselves. So I would love to hear just a little bit about your workforce journey and how you got here today.
Yeah, well, of course, I'd love to be able to share that. So just as a high-level overview, I've been working in HR and specifically healthcare for well over a decade now. It is very scary to say that because that time went by quickly. But for the last 5 years, I've been working in this new field that many of you know of called workforce development. I started with the network in late 2022 and went into a newly created network director of workforce development role. Prior to coming here, I worked at a large organization out of the Midwest called Advocate Health as our manager of workforce development. I have a little bit of an eclectic career path to what got me to where I am today. I'll keep it brief, but I came from a very blue collar family. I started an apprenticeship after high school. College was not an expectation. Neither one of my parents attended college. So I worked my way kind of through a carpentry apprenticeship and then found myself saving up money to go back to a local community college. Ultimately, I ended up with my master's and fell into HR, but it was a really long and hard journey. I had to do a lot of the exploration and the discovery myself. I really didn't feel like the employers I worked for at the time had a lot of career pathing or talking about where I can start and where I can end up. So it really influences how we build our workforce development programs. So I use my personal journey to really influence how we can build programs for our employees. But I'll turn it back over to you. I could go on all day about this, but that's just like a high level overview of what brought me here today.
And that's really interesting. I know a little bit about Advocate Health, and that's a very large system and has lots of suburban and primarily urban system. And then you relocated to Vermont, which is a much more rural area and community. And that sounds like a really interesting kind of transition there. And I would love if you could tell us just a little bit more about the health network. And does that feel okay to use that shortened? I don't know how y'all shorten. Everybody shortens everything, but health network, if
Yeah.
that feels okay. So tell us just like a little bit about like the basics of the health network and what y'all are doing there. And then, how you had to adjust your strategy or your thinking around workforce development for a more rural community and meet those needs.
Yeah, definitely. So I will say, we often use the network as the term, so I'll use that going forward, but it's short for the University of Vermont Health Network. We are a integrated academic rural healthcare system serving more than 1 million patients across Vermont as well as northern New York as well. Overall, we are consisting of an anchor academic medical center in Burlington, Vermont, and then we have 5 community hospitals spread out over Vermont as well as northern New York, and we have a children's hospital as well. So overall, between those 6 facilities or 7 facilities, we have 1,600 inpatient beds. We have 50 total sites of care across our geography, a multi-specialty physicians group. We have several skilled nursing facilities as well, and then a home health and hospice partner as well. Large organization comprised of about 15,000 employees total. 1/3 are considered our frontline workers, requiring less than an associate's degree for the role. But like you said, rural workforce development, much different than urban workforce development. I've learned a lot from the team, having not started the initiatives here, but partners like our Central Vermont Medical Center in Berlin, in the Central Vermont region have really pioneered some of this work and looked at how we can develop workforce development programs in a rural workforce setting. So I've learned a lot since coming here, applying some of what I learned in more of an urban setting, and being able to apply that here. But our teams have had to be very creative in how we build innovative approaches to workforce development and meeting our workforce needs. Like I mentioned, it's been occurring longer than I've been here, but we really need to look at and how we build programs, make sure we don't oversaturate the market when we put up workforce development programs. We lack, unlike an urban environment, centralized population. People are our biggest resource here, so we need to be able to invest in the communities across, but we lack an overall population like an urban environment does. But we also lack, and we can get into this in a little bit, housing and childcare, and then multiple means of transportation as well over a large geography. So like I mentioned, we are trying to build workforce development programs that don't oversaturate the market. So we need to build programs that train just enough so that we can fill the positions that we have in our region. But we also need to look at developing partnerships that are expansive over a large geography. So really looking at more online telepresence learning and how we can also partner with some brick and mortar campuses. As we look at transportation across our geography, our population that works for us may be an hour and a half or 2 hours away from a brick and mortar college partner. So we need to look at how we can build programs and advocate for our employees so that they can work and go to school at the same time. There is a lot to talk about there, and I'm just scratching the surface, but I'll turn it back over to you. Let me know if you have any follow-up questions there.
Yeah, well, there are 2 nuggets I just want to highlight there is that you said people are assets. Yeah. And like, let's just say it again for the folks in the back who sometimes are still looking at their profit and losses and looking at their staffing as a liability or a loss. Like the people are the thing, right? They're what makes the business run and the organization run, in regardless of sector or what that looks like. So people are assets and important to invest in. And this advocating for your workers, right? This figuring out how that they can do 2 of these things that are really important, still get a paycheck and learn new skills. And that is requiring some advocacy on your end. And that feels really important part of workforce development that is also not always a part of the big picture, right? And making that case to leadership and why it's important, because we all know, right, in workforce development, like we see the numbers and we're like, what are you doing? But sometimes folks who are at a different level have a different perspective, and a part, it sounds like, of your job is helping them see that big picture and connect the dots of why this investment is truly important to the organizational goals, to what they're trying to accomplish, to their mission. Does that feel accurate?
Overall, it has to be a win-win. It's a win for us because we're getting the talent we so desperately need, but we also want to build programs that advocate for our employees by ensuring they can work and go to school at the same time. I think a big part of our programs is investing in our overall frontline workforce and our community by building programs that let people go to school as well as put food on the table as well. And I think that's a delicate balance, but I think it's key in order to build a successful workforce development program.
Yeah, and what that point is leading to a little bit, right, is that what workers consistently report as barriers to work are what I consider the big three: housing, dependent care, and transportation. And you've mentioned all of those. And that the network is working to tackle two of those three big issues with housing and childcare. And all I can say is tell me everything, which you can in this amount of time.
Yeah. I would love to tell you everything. I don't know if we have enough time today to talk about everything, but I'd love to scratch the surface and tell you a little bit more. And I'll start by saying what drew me here to the network back in 2022 is how the network is using innovative approaches to be able to support our workforce, such as the housing efforts that were going on at the time, and coinciding with also the daycare efforts going into that. So a high-level overview of that is, and we all know on this call, housing and childcare present huge obstacles for all of us across the country. It helps us recruit and retain workforce when we can have affordable and an abundance of housing. You know, we're only scratching the surface, but recently we've partnered with a number of developers across, and we're working on 3 separate housing and apartment complexes, both in the Burlington area and in the central Vermont region. We are building 3 separate housing subsidized apartment complexes with totaling about 196 units, which is absolutely amazing. And it's going to help our workforce a ton. Not solve the problem, but contribute to the overall solution. Those facilities as well, some of them will have embedded childcare facilities for our employees as well. Later on this year, we're going to be opening a 120 unit apartment complex. It's actually going to have up to 75 spots for children up to pre-K, and it's going to be in partnership with a large childcare provider, similar to how we've constructed the unit with the developer. We're going to have that same partnership with a childcare provider. Amazing asset to be able to offer our employees and individuals we're trying to recruit here. Often we see our talent acquisition team making an offer, and those individuals either have to turn the offer down or leave when their temporary housing's up because they can't find affordable housing here in order to stay here, though they want to work and they want to live in our region. So it's going to be an overall win for our employees and a win for us as well to increase talent here.
Yes, I agree. Like, that's such a huge thing to take on. And I know that many employers feel kind of frustrated, right? At the idea that these feel like big systemic problems. We didn't get here by accident, but we got here with a lot of intentionality from a lot of folks in positions of power. And we're at a point where our social safety net is not where it once was. And that in order for people just to even be able to show up to work, employers are being required to start trying to think about how they might contribute to some of these solutions. And so I really appreciate the network's willingness to even explore, right? And not only did you explored and then you're working it out and you're making it happen. And I think that that's such an important distinction to make, right? That not everything always leads to yes, but there is something to learn in the journey and the process of learning where the stumbling blocks are and how you might overcome them. But then also, having this big idea come to fruition and to see what it's going to look like when you have folks who are able to live in the same community in which they work, which is not feasible in a lot of places.
We have a lot of very passionate leaders here doing some really groundbreaking, innovative work. We have a lot to be proud of, and really glad we can showcase it at this level and be able to talk about our journey, so potentially other systems or organizations across the country can learn from us and what we did well and maybe what we needed to improve for next time.
Now, I don't mean to put you on the spot, but we did talk a little bit previously around some specific programs that y'all have about nursing. And I know that, we're in crisis, whether or not we're labeling it a nursing crisis in the way that we have done previously as a society. Anybody working in health care is fully aware that we are in a crisis, and particularly around staffing and upskilling nurses. And if you feel okay, I'd love for you to share just a little bit about that work that y'all are doing, because I know folks on the line are interested in hearing about it.
Yeah, amazing work that's going on. It's been going on for several years, far predating me coming here and joining the network. But it's really built some best practices that we can learn from and then scale to other parts of our network as well. And I'll just back up and say, I mentioned we have 15,000 employees that work for us. But at any given point, we have about 800 nursing and nursing support positions open, which is detrimental to our patient care. It adds costly traveler costs. It puts a burden on our existing staff by having to work more and it creates potential burnout situations. So we've been able to build several nursing programs partnering with our local community colleges and state universities. I'll mention one specifically in Vermont. We've created a nursing pathway program. Back in 2019, our Central Vermont Medical Center did some focus groups with the employees and found out, what are some barriers to them going back and pursuing their dreams to become a nurse or upskilling to become, a licensed healthcare professional. And they found that those individuals needed to be able to work, put food on the table, and pay their bills, but also they had a desire to go back to school. And the balance of both led us to be able to create a program that allowed individuals time away from work where we get paid, we call them paid study hours, and allowed them to go to school and we pay them for it. So it functions kind of like an apprenticeship program. We call it a pathway program in-house. And then we partnered with two, our local community college of Vermont and Vermont State University to be able to tap into the curriculum that both of those programs offer and really create an innovative program. Now, one of our programs allows individuals to have clinicals every other weekend as opposed to during the week so that they can focus more time on work during the week, and then doing every other week clinicals, and then also advocating to be able to do evening classes as well so that they can focus on work and then they can focus on school, and then we pay them in order to make sure that they can study. The program has turned out numerous nurses who, ultimately first get some of their prereqs done. They go into the LPN program, they go into the associates program, and then they continue on and upskill throughout all the programs that we've built since. Very detailed, but I just wanted to give you kind of a little bit of scratching the surface just to get everybody interested.
Yeah, I love it. I love a lot of what you just said, but really what I'm ultimately hearing is that you're engaging the people that you're trying to help, figuring it out what it is that they need to be successful, and figuring out what you as an employer can do to support them and help them in their journey to be successful, so that this is a mutually beneficial, as you said earlier, a two-way street, right? In which this works. And I think that that's just a key framework or a key philosophy in doing this work that can vary. And when that philosophy varies, I think the outcomes can vary. And in the revision and relaunch of the recognition program, we really worked to try and uplift some of those workplace practices. So it is about building the skills and the careers of those individual folks in the programs, but it's also the practices of your organization, how y'all communicate with each other, how y'all understand each other, particularly in such big systems. And there's lots of things that fold into that about how people feel about their job. Like, do I feel good? Do I like the job that I have? Is sometimes more important of those other factors than the job itself. So I love to hear that y'all are kind of taking that wider approach and really thinking about meeting people where they are, as opposed to thinking of them as a problem that needs to be solved, right? So I love that. I do want to just offer anybody in the audience that if y'all have some questions, now is the time. We have about 10 minutes left, 8 minutes. I don't know what time is, a few minutes where we could take some questions, but I don't see any coming through. So if you have them, send them. And if not, I'll be continuing to ask questions because I have so many of them. What I'm curious about. Oh, okay, here we go. LinkedIn user. Has partnering with college been relatively easy and frictionless, or has there been a wide variation in the readiness of the colleges to partner?
Oh, that is such a loaded question. So I'd love to be able to say it's been easy. But I'll just start by saying colleges like healthcare entities are seeing the same financial struggles as we are as nonprofit healthcare systems. They are seeing decreased enrollments. They are seeing are having to make really tough decisions on closing programs or really shifting away from some of those programs that have existed for years. So we need to be able to jump in and support them. There's been a lot of discussions between our college partners and our team to be able to advocate what's best for our employees. It's not always an easy go. There are things that those college partners are working with, like their accrediting bodies, the financial pieces of being able to do things like um, telepresence learning and online learning. You can't just shift some of those things overnight. So I'm just really grateful that of all of our local college partners, we're engaged in talks. Some of those talks are further along than others, to actually the point of now that we're implementing them. But it can be a point of contention when there's a school that hasn't done a lot of the work that we've done yet, and getting them to buy into what we're trying to bring to the table, which is a little bit more of an adaptive learning program for non-traditional learners. But far from easy and frictionless, but we'll get there. We definitely need to in order to make sure that we can continue to meet our workforce needs across the country.
Yes, absolutely. And the National Fund has a couple of projects that are looking at partnerships with community colleges. And we love our community colleges, and but there's complicated factors on both sides. So it really does take some energy and willingness to be open, candid, and to work like together. Like the work part of that is real, and in a true partnership. There is lots of interest in the LPN to RN pathway, not surprising. And for accepting in the Earn and Learn program, do you use any criteria about who you need in the program most, or is it criteria about readiness for the level of learning?
Oh, so deep of a conversation there. So I think when you look at there's a couple of layers to this. We, as a workforce development team, we could dig the trench a mile wide and an inch deep with so many needs out there. So we've developed a set of internal criteria of questions we ask ourselves of where we go first. Some of those questions we've determined before we go down a path of LP and RN, or do we go into a completely different area? We ask ourselves, how does it contribute to overall patient care? Is it going to allow a higher level of access to our patients by creating more individuals in certain areas? Are there philanthropic dollars surrounding it? What's the overall need, and how does it contribute to the overall strategic plan of the organization? That being said, we have 5 core areas where we're developing programs in: peri-op, nursing, lab, radiology, and respiratory therapy. Those are our 5 core areas where we feel like we are able to tackle and build some pretty innovative programs, and really excited that workforce development often doesn't get invited to put up programs for this level. So I feel like we're doing something really innovative here. But in criteria around who is ready for that training, we work really closely with our leaders across the network, as well as our college partners. There is some assessment that those individuals go through to determine, are they academically ready for those programs, as well as making sure that we have a complex interview process on who is the first and who is going to be the most successful to go into some of these really in-depth programs. Not everybody can take an anatomy and physiology class and be successful. It's a really tough class, so we need to make sure we put some of those priority and screening criteria up front. I know you asked a pretty broad question, but I'm hoping I answered it from the micro and the macro level.
Yes, thank you very much for that. And Diane, I see your question, but we're going to continue that conversation and mobilize. So I'm just mindful of the time. We have a few minutes here, and that means I have just a few little announcements to close this out before we completely wrap up. And the idea that we will continue the conversation is something that you should hold true. CareerSTAT members get access to an online community of practice that we use called Mobilize. And then additionally, CareerSTAT members will be invited to participate in a peer learning session that's kind of just like this, but going to that next level. So we're going to take our 3 panelists from the previous 3 sessions and have those on a quarterly basis that are really intended to be an informal space for folks to come with their tactical, practical questions and get some more insight from our champions. Our first one is tentatively scheduled for April 17th, but we're still fine-tuning. So save the date for now, and more details will be coming soon. I also encourage you to mark your calendar for the series as a whole. These interviews will be held the second Wednesday of the month at 1:30 Eastern time from now through September. So get that recurring event on your cal to save this 30 minutes. In the future, our next session will be on March 13th and is going to be with one of our emerging champions, Union Health Center, which we are really excited to have them get recognized as a smaller entity and doing something a little different than our larger health systems. And they have lots of insight to share on that level. So we're really excited about that. Also encourage you to save the date for SHIFT, the National Funds biannual convening. That is taking place September 27th through the 29th in Memphis. Registration launches in April, but again, get that, save the date on your calendar to make sure that you are available to attend, because it is a great convening and there will be lots of great content. Oh, Josh is telling me I said it wrong. It is September 24th through the 26th. Disregard my previous statement. 24th through the 26th of September in Memphis. And then the best way to stay in touch with all of this stuff is to join CareerSTAT to stay in the loop. So there should be a link in the chat around where you can learn more about CareerSTAT. It is free to join, and it is open to anybody across the continuum of healthcare and partners who help implement that work. So those community partners who are helping with those wraparound services, the community colleges that are helping with that training, those folks are also members of CareerSTAT and welcome into the community. So you should be able to do that. So you get all of our messages that are coming out to keep you up to date so you continue to learn. And then in closing, I really want to thank Jerry for being our first little guinea pig in this interview series. This was really helpful and insightful, and I know that we've got some wheels turning for the folks who were able to join us today, and we will continue to share this with our network on the link. So as always, the conversation continues, but thank you so much, and congratulations again to you and your team.
Thank you, Melissa.
Thank you.